person's trying to leave, don't do that, right? And I touch them, battery. You're not gonna leave, and I'm holding him down, false imprisonment. I'm holding you down regardless, both. Like you're touching somebody with that. That's what I'm saying. Like usually in court documents, you'll see both. You shouldn't have been taken to begin with. Battery.
What if you put them in seclusion, that's considered false imprisonment?
If it's against their will and there's no reason for it.
What if it's like a patient who's like being violent and say like
So-
they already hit someone?
Let's go back to mental health. If a person is, right, at risk, not even doing it, at risk for injury to themselves or to others, you may apply restraints. And if you do, without a doctor's order, that they're just going out of whack right now, what's the time frame? 1 hour. You must achieve a restraint order within 1 hour from a prescriber.
Question, what happens if you don't? Other
You're
than
legally
just-
liable.
So,
Right here. And it'll never be as complex as with the situations you've faced in the SNPs. The question stem will arbitrate what's happening. Are they at risk for self-injury or others? Or are they not? Very straightforward. Okay? If these are happening, there it goes. Your job is to decipher were they competent or not. So hence then I get, well, what about 5150s? You answer your own question. Right? They are at risk for self or others, and they are now on a 3-day hold. They are not free to leave. The trick question that I get is because people think, right, that people that are in mental health institutions where you're held in a locked facility, they're like, well, can they leave? Well, not if they're in 5150s. Not if they were in a hold against their will already. But if I feel suicidal, and I'm like, and I check myself in, I didn't come here on an involuntary hold, I can leave. Yeah.
Unless you become.
And then if I step out and they're like, well, he's at risk, boom, they got you on involuntary hold.
tackle you down.
So there's a dilemma, right? There's a dilemma. Like when is it that, right? That's gonna be more arbitrary, but this is not a situation like, well, they were at risk, you know. So, whenever you're reading questions on ATI, ask yourself, what is this asking you? Is it a safety question? Is it for mental health? Is it an ethical practice? Like what is the purpose of this question? There's always a purpose. So separate it, right? These are the fundamental questions about safety and security, the mental health questions about priority actions for schizophrenia, bipolar, whatever. It's about ethical practice, leadership and that. Like you have to then see what is it asking you. Don't overcomplicate it. It's from one of the subjects. Make sense? All right, are we clear on this one?
Yes.
Okay. Impaired coworkers, go to page 47, right side. In short, if you find your coworker to be either you know they are impaired, they're doing drugs, or they're doing alcohol, they're doing weed, you have to report it. Okay, you don't confront them. So if you read through it, it's basically what it says. Impaired healthcare providers pose a significant risk to client safety. A nurse who suspects a coworker of using alcohol or other substances while working has a duty to report the coworker to appropriate management. At the time of infraction, a report should be made to the immediate supervisor, charge nurse. Okay, your healthcare facility policy should provide guidelines for handling this. Each state court has different, like basically disciplinary actions. And healthcare providers who are found guilty of misappropriation of controlled substances can be charged with a criminal offense consistent with the infraction. Behaviors can be difficult to detect in the impaired nurse's experience at masking the substance use disorder. Now, that's what you gotta do. So if you're asked and you're suspected and it describes the person being under the influence, your answer is you report it, okay? Now, what will you see being phrased in the question, or if it says what leads you to suspect, these are the answers. Behaviors consistent with a substance use disorder. smell of alcohol on breath or frequent use of strong mouthwash or mints. Impaired coordination, sleepiness, shakiness, or slurred speech. Bloodshot eyes, mood swings and memory loss. Neglect of personal experience. Excessive use of sick leave, tardiness, and/or absences, especially after a weekend off, holiday, or payday. Frequent requests to leave the unit for short periods of time to leave the shift early. Frequently forgetting to have another nurse witness the wasting of a controlled substance. Frequent involvement in incidences where a client is assigned to the nurse reports not receiving pain medication or adequate pain relief. Documenting administration of pain medication to a client who did not receive it, or documenting a higher dosage than has been given by other nurses. Preferring to work the night shift where supervision is less, on units where controlled substances are more frequently given. Okay, you are mandated to report.
That sounds like all the nurses that work there.
Probably are. It is more common than you think. Okay, and it's like I said, it's not uncommon. Right? People showing up severely hungover, and because they slept, it's like I'm hungover, you're still drunk. You haven't slept at all. Okay? You'll see it, and it's up to you whether you want to make the right choice or not. And I always tell people, just envision that's your family they're taking care of. Okay? Don't do it. Second of all, the board does not play when it comes to it. Okay? If you want, feel free to look up like either the BRN, at least for California, or the BBNPT, that's the board for LVN, the psychiatric techs. You can look up the committees where they do them, like I think once every month or two, they record them. And you get to see the trial recordings of nurses who have their licenses revoked, they're asking for them back. And they're presenting, their information and appeals documents and everything in order to be able to receive their license again. These are people anywhere ranging from stealing narcotics to having opioid use, alcohol disorder, DUIs, multiple crimes, okay, drug use and whatnot. And because they have even just been accused of it, you can lose your license. The board is not a criminal or public court. They are the board. So there is their own trials. It is not your right to be a nurse. It is your privilege. You have a license that you do or use. Alright. And you'll see that. I tell people it's hard to get your license if something you have a criminal record, whether it's a misdemeanor or not. It's even more difficult once you already are licensed and you lose it. Because then it's like you should have known better. Does that make sense? Like you're already here. And I tell people you don't need to be convicted. You can have been arrested for it and it's already gonna probably throw your license under pending investigation because you're in that situation to begin with. So you're questionable. Okay? And lastly, if you or a person you know is having a substance use disorder, whether alcohol, opioids, or anything else, it's better if they come clean and ask for help. And then the board will not revoke their license. They'll put them in a treatment program or monitor them while they're in it, while you receive frequent testing, and they'll not revoke it, I've heard, rather than if they catch you, you will be revoked.
I knew a nurse whose husband was a drug addict, and he was also a nurse, and that's what he did.
Yeah, they monitor you because you came clean and you want help. If they catch you or you are charged criminally because of behavior you're doing outside of work, you're gonna lose your license. Okay? So I tell people, I'm like, this is a lifestyle, and I think that nursing has blown out of proportion to what people are like, it's just a great job with good pay, and that's true, and it can be for you. But unfortunately, because of the standard that a lot of professional leagues within the profession stand for, they hold everybody accountable. So just be wary of that and don't mingle. And always, I think people think it's cool to like go after work to like happy hour. Take off your uniform and have spare clothes or something. Don't do that. You're public, by the way. People just Google your name. When you come up on Breeze, they have all your info, where you live, where you get registered. True. I always let people up. But they're not nurses. Like, I'm a nurse, I'm like, oh, are you?
And you check, and now you use DNA.
Alright, so, that's how you get jobs, because it needs to be public, because if you're hired and or are being accused of anything by a patient, they need to have public access to your information, so you're registered in an online registry, like publicly.
So, if we do smell the cologne or mouthwash, like, we have to report that, because that was a question on the quiz. So that would be an answer.
If it's a question on my test, you report it, if you suspect.
It can't be that their breath smells or something.
Can be what?
It can't be that their breath just smells or something.
Look at, if you show me the question, the other answers, it should, something else should make a lot more sense. And if it doesn't, it's reported. Yeah. Because then it's asking about this. Like again, is it asking you about this? The answer is reported. Alright. Abuse. You guys know to report abuse, right? If they have bruises that are not consistent with their care, dehydration, malnutrition, verbal abuse, physical abuse, you must, and you are mandated to report it. You have to report it. Okay, so you do your assessment and they have all these bruises, you gotta report it. Transcribing medical prescriptions. When transcribed, it's on the right side of page 48, not 49, 48. Transcribing medical prescriptions, so you should make sure to include, so you read back to the doctor, right? The date, time it was written, the frequency, dosage, route of administration. An easy way to remember this is the 6 rights of medication administration, excluding documentation, because you're not documenting, right? Because you didn't give it, for prescription. That's an easy way. Some people tell me, well, now there's 7 or 9 or 12. I said, no, there is 6 according to the NCBSN, so just follow that. Okay? You are getting your license. I get that there's more, and when they kick in, they kick in. There's 6. Okay, follow institutional policy regarding the time frame in which the provider must come sign that he prescribed that. 24 hours. Okay? Make sure you repeat it back to him. Communicable diseases. There is a chapter in fundamentals that will tell us more about it. You should look at infection control in your fundamentals book. You'll see the list of the infections that need to be reported. The ones that it talks about here, right there, there's like hepatitis A. I'll tell you as well, tuberculosis, HIV, I believe gonorrhea and chlamydia. They need to be reported to the health department to track incidences and make sure that there's not an epidemic happening. Yes? All right. What else? So please non-impaired co-workers. Okay. So let's go to chapter 5, page 74. On the right hand side, it says reporting incidents.
Oh, this is the first page. 65.
Reporting incident. Facility protocols. Refer to the plans and procedures in place to address specific issues that healthcare institutions face. Nurses must understand their role in relation to development and implementation of facility protocols. So in short, it'll talk about when to do an incident report, okay? And it says examples when an incident report should be filed: medication errors, procedure treatment errors, equipment-related injuries, needle stick injuries, client falls, visitor volunteer injuries, threats made to client or staff, loss of property like dentures, jewelry, personal, wheelchair. Nurses must ensure the safety of clients' valuables. So, in short, I'm gonna tell you what it is. Anytime anything is missing, here it said 3 things, but just any property is missing, or anybody is hurt, or anybody is threatened, whether it's staff, patient, or a visitor at the facility, an incident must be reported. Is everybody clear with that? Injury, fall, threats, missing property from anybody on the facility, basically. Yes? Okay. Nursing role. In the event that it does happen, basically you just need to document it as it is. So incident reports should be, now we're on page 75, left-hand side. Incident reports should be completed by the person who identifies that an unexpected event has occurred. Should be completed as soon as possible and within 24 hours of the incident. Considered confidential and are not shared with the client. It is not acknowledged to the client that one was created. This is meaning that it is fully internal for the facility. The client is not said. You never put it in their chart. You never do any of that. Okay? See, it's not placed nor mentioned in the healthcare record. However, a description of the incident should be documented factually in the client's record, including an objective description of the incident, forward to risk management, or can vary by facility, but possibly you'll give it first to your nurse manager. So if it says nurse manager, unit manager, risk manager, that's what you give it to. That's the correct answer. When completing an incident report, make sure it's factual, not objective. Names of witnesses and any corrective actions, right? So we gave the wrong medication dose. I called the provider at X time. Provider said this, charger was aware, vital signs, what happened? The client is on the floor. You don't say, the client fell and I found him on the floor. You say, the client was found on the floor, sitting down. Vitals were taken, was XYZ, was returned to bed, blah, 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 blah. Factual. You don't say, and then Maria came in and she started saying that, blah, blah, right? Irrelevant, okay? So you just factual. Then, you place it, you give it to risk management. You never place it in the healthcare record. Yes? Okay, let's take our last 10, and then we'll get started for the last few things to cover.